Welcome in. Today we're going to be talking about posterior composites. I know that there are people from all around the world logging in, and I welcome all of you. Thanks for tuning in, and I'm hoping that we can discuss really more of techniques on how to make sure posterior composites are predictable and making sure they're beautiful and making sure our patients are happy and making sure that you're happy. So I live in Vancouver, Washington, in the United States, and I wanted to thank everyone for logging on and let everyone know that this is a ADA certified CE webinar. So afterwards you can log on and take some CE questions and get credit. So let's go ahead and begin. What I really wanted to cover today was basically three main things: knowing good composite materials, knowing good bonding, and how to effectively use a sectional matrix system so you can have predictable success every time. I wanted to thank GC America, who is sponsoring this webinar, for being so gracious to do so. They have some great products out there, and that's why I agreed to do it for them, because of the predictability of their products that I've been using. So we're going to be highlighting a couple of those today. I wanted to start out with a very routine a DO on number 13, MO on number 14, something that you'll see in your practices every day. We have decay on the distal of 13 and a failing amalgam restoration on 14, and we are going to restore both of those with a packable composite. So as we remove the decay here, we can see it's pretty deep on the distal of 13, and so we want to be careful on how we're excavating that decay, and then think about how we might begin to restore. Are we going to use a liner? Are we going to use a flowable? What's going to be the most predictable and the least postoperative sensitivity? So here the tooth is all cleaned out, and we can see that it's a pretty good size. Now I would probably line this with a flowable in the box. That hasn't always been the case. I had actually gone away from flowable for a number of different reasons for quite a few years, but with the advent of bulk fill flowables and their decrease in shrink and stress, I had kind of moved back to that idea of using a flowable resin in the box. Now, we'll talk about bulk fill resins and their advantages and disadvantages a little bit later, but it's interesting to understand how each composite works, flowable or packable, and why you would use it in certain circumstances and situations. Now here, with a deep carious lesion, we might think about lining the restoration with either a glass ionomer, a resin-modified glass ionomer, or some other type of lining material, like possibly a Theracal by Bisco. Now GC America is known for their glass ionomers. They have had some for so many years, and they are second to none in the dental market with their glass ionomers. Putting a pure glass ionomer, such as Fuji Triage, which is a pure glass ionomer, no resin in there, is probably the safest bet when you are the closest to the pulp. That is where you're going to have the most compatibility, biocompatibility with the material to the dentin. Now, resin-modified glass ionomers are nice because you can also light cure them, and you can get a little bit quicker setting times. But a pure glass ionomer like Fuji Triage would be the best if you are really deep. So anyway, let's move on here with this case that we have. You can see that I am placing a matrix system. This one is by Triodent. I really like it. It gives me great contours. You can see how well it seals down there in the proximal box. The other thing you're probably noticing is, hey, this guy isn't using a rubber dam. Well, that reason is because I use a system called the Isolite. Now you can see it just a little bit up here in the corner, right there. That's part of the Isolite. I wanted to share with you this system because it has revolutionized the way that I do dentistry. Isolite is an incredible system. I was kind of skeptical at first at how well it would work, and then I bought it and I tried it, and I use it on every patient, every procedure. It's incredible. It's great for isolating the area, making sure there's no moisture. It's comfortable for the patient. It retracts the tongue. It suctions everything out. It's just very, very handy. It has a light. It illuminates the area that you can dim for curing. It's hard to practice without it. For example, let's take that in that picture there. Imagine you were preparing a crown prep right here on number 18, and you have that big tongue and lots of saliva, and it's hard to see. Having something that takes the tongue away is priceless. You can reduce your procedural time. Everything is just a lot better. I would say about 85% of my patients can tolerate it very, very well. And then there's another percentage who just gag with anything that you get even close to the mouth, so they can't handle it. But overall, I think that if you're having troubles with the rubber dam, or if you'd like to look at a different system, or if you've just been using cotton rolls, Isolite is a great way to go to improve the success of your posterior restorations. So here it is, an actual Isolite in the mouth, and that's kind of what it looks like. It works really, really well. Again, one of the reasons why I talk about this is the importance of using either a dam or an Isolite to make sure that the area that you're bonding is moisture free, because bonding of resin to contaminated area definitely degrades the restoration. If you look, it says in this study that was done in 1995 that contaminants lower the bond strength by 20 to 100%. So it depends on how much moisture you get in there, but it definitely is degrading to the bond. Someone had asked what's the cost of the Isolite system, and it depends. It varies on whether or not you get the one with the light, which is I believe around $1,500, and then the one without the light, which is significantly less. I think it's around $700. But then you can buy the mouthpieces separately. There's another study that I thought was interesting that was published in 2010. How when there was saliva that was exposed, the tooth structure was exposed to saliva, then there was the presence of structural defects at the tooth resin interface and the pull out of shorter resin tags, hence indicating the necessity to make sure you have great isolation when doing your composite restorations, any type of bonding in any way. I use the Isolite when I'm bonding my crowns into place to make sure that there isn't any moisture contaminating that bonding surface. So again, the Isolite advantage is you don't have any moisture in the procedural area. The retraction of the tongue is huge, allowing a good opening so that you can practice the way you want to is definitely beneficial. I think the other thing is that it actually helps you practice faster. There are fewer breaks, fewer interruptions. You don't have to explain to the patient what to do. They don't have to swallow as often. You can just get in and get out and get done. I'm able to do a lot more work in a short amount of time. So going back here again is the Triodent system. I love this system. Dentsply has one similar, but Triodent was the inventor of it. The reason why I like it so much is how the rings and the bands work together with the wedge to create just beautiful contours that mimic natural teeth and have very little adjusting when you're done. If you know how to place the bands the right way, making sure they're nice and tight, but you get beautiful contours in there. So if you haven't tried the Triodent V3 ring system, I would highly recommend you do this. They come with some now super curve matrices. That's this one here in the green. Comes with about 4 or 5 different heights, just so it can be perfect, whichever height you need. Maybe this one that's a little bit deeper. It has green, blue, purple, gray, different color codes for how tight you want that. And this color coding is actually a non-stick coating, so your bands can pull right on out. The other thing is that these are nickel titanium rings, and so their spring can be resprung. You can reset it so you can make sure that they're always nice and tight contacts, and nice and tight the way that it holds the matrix in there. So that's another beautiful thing about that. They also offer what's called the wedge guard, and you can put this in to make sure you don't damage adjacent teeth. Not that I've ever damaged adjacent teeth, but if you have, then maybe you understand. No, I've done it before myself. It's something that's sometimes inevitable, And so having something there that protects the adjacent tooth prevents iatrogenic damage. And when you think about the wands and the wedges, one of the nice things is that they fit in together. I wanted to go back here. So you can see that I have a pink wedge coming here from the lingual. One of the great things about the system is that because it has the V shape, you can also put a white wedge or a different color wedge from the buckle also. You can see here with these V-shaped portions of the ring, you're able to get multiple wedges in there to make sure you have a very, very tight matrix against the tooth, hence decreasing the amount of flash that's there. So a very great system. If you haven't used it, I highly recommend it. All right, going back. Here we're into bonding. This is, you can see, this is what's called a fiddle etch. So I'm putting phosphoric acid all over the tooth surface and etching the entire time, the entire tooth. Once that's done, I like to go back in and re-wet my tooth to make sure it's at the optimal wetness. And I usually do that with a chlorhexidine solution. Some people like to use Composites. I use Cavity Cleanser by Bisco. It's a 2% chlorhexidine solution. And chlorhexidine has been shown to decrease bond degradation within the first 6 months of that bond setting. We know that different things, moisture and things, can degrade the bonds in the first 6 months, and that can lower bond strength. And chlorhexidine has shown to inhibit bond degradation, and that's one of the reasons why I use that as my re-wetting agent. Now, some people use Gluma. That's great. Whatever you're using, I would use a re-wetting agent if you're doing an etch and rinse system. Once that's done, I air thin that down, and then I start to place, in a 5th generation, this is the primer and bonding agent in one, and I coat that over and over again. I air thin it and I coat it again. I probably put in 2 to 3 coats, and I'm scrubbing it in. The scrubbing really is effective in getting those resin tags to penetrate deep into the dentin and into the enamel. So there we go. You like to have that nice glossy finish when you're done, and cure that, and then you're ready to put in your composite. Here I'm using a flowable composite. This is a bulk fill flowable composite. This is SureFill SDR Flow, and it is you can see it's more translucent, so the light can penetrate deep. You can place this up to 4 millimeter increments. And this was before GC came out with this other product called Genial Universal Flow, and it's a stronger flowable composite that I've also begun to use, which I really like. And I'm going to talk about the similarities and differences here in just a moment. But putting down a flowable so it goes into all the crevices is a very popular way of restoring composites. Next I go in, this is with GC's Color composite resin. I like to use this instrument. This one's by Garrison, and it allows me to put in some nice anatomy before I cure it. And I think that putting that in can really decrease the amount of time you're spending contouring the composite after you're done. And so packing that on in there, I like to do 1 increment of flowable and 1 increment of the packable resin. If I can decrease time, increase predictability, that's what I'm all about. So I'm looking for a 1-step packable composite that looks beautiful, so I don't have to layer that packable composite with a dentin shade and an enamel shade. And that's what Color has really done for me. It allows me to do 1 shade that really looks beautiful anywhere. One of the things about Color, you can see this was this graphic was made by Kerr, and they're highlighting their products, 0.4 Prodigy Herculite Ultra, but you can see where Color lands here. It is a little more stiff than maybe Filtech Supreme. That's what a lot of people use here. And it's definitely not sticky, which is great. I really like the handling of Color. It's not sticky, it's stiff, it doesn't stick to my instrument. I'm able to manipulate it pretty well. And that's, again, knowing your material, knowing what kind of handling you like is very important. So again, I go in here and put some initial anatomy in and then cure it. You can see there we are. So then, once I take off my matrix, I like to cure it again. You can never over-cure composite resins. You can always under-cure them. So they can say, hey, this cures in 5 seconds, it cures in 10 seconds. I never believe them. I always cure 20 from the occlusal, 20 from the buccal, 20 from the lingual. I just don't want to take any chances of under-curing my composites, right? I always want them fully cured, so that's what I would recommend. One of the things I also try and do, as you can see here, the amalgam restoration is still there, number 14, and I've completed this one here on 13. I like to sometimes, if I have the time, complete one side of it and then contour it up so I have just the most perfect contours. I love using discs. These are 3M Softflex discs, and those are just fantastic. Oh, someone had a really good question here about, am I curing my flowable, or am I placing it and then using your packable on top of it prior to curing? That's an interesting method. It's called sometimes the snowplow method, where some people put the flowable in the box and then push it so it fills into all the voids. Depending on the type of flowable you're using, that's an interesting method to use. You have to be careful to make sure that you're doing that technique right, but it's definitely a technique that works. Now because I put a significant amount of flowable in the box, then I'm curing the flowable first, and then you can go back and put your packable on it. Some people put a good amount of flowable in the box and then cure it, and then maybe another small little layer and then the packable on there, and that's also an acceptable procedure. Whichever way you do it, make sure that you understand how that's being done. Yes, and someone else asked, did I just use one increment of the packable? And I did. It's just one increment, and that's what I'm trying to do. All right, so I like to contour, make sure I have those beautiful contours. So in the end, you can get something like this, where you have beautiful marginal ridges. When you have proper anatomy and contour, the patients can feel it. The tissue is more healthy. Everything works a lot better if you take the time to get beautiful contours, beautiful marginal ridges that can function well inside of the mouth. And there it is after the polish is done. You can see how well color blends into the tooth. It's just beautiful, and it holds up really, really well. Now, I don't always get this, but I was done. When you get good anatomy, it's more often that you don't get as much occlusal interferences when you are checking your occlusion. I make sure that in any excursive movement, I have them bite down, I say chomp, chomp, and grind, and I want them to really grind in there so that they can make sure that we are trying to make sure there aren't any interferences in any excursive movement on my resin here, to make sure that it can really last as long as possible. So there we are, start to finish. I think that the one at the end looks quite good and is very functional. So let's talk about materials. What materials we are using. A little analogy here to understand the materials. I love to cook. That's me in the middle. And we do chop competitions in my house where we don't know the ingredients that are coming, and then we open up a bag and there are 3 ingredients. We have to make a dish. And so you really have to think about, what am I going to use to highlight these ingredients? How can I make these ingredients stand out? How do these work with different heat and with other materials? And here I am cooking up a little lamb here and creating a side dish for it, and thinking about all the different things that can highlight those ingredients. How do they really get their flavor? What happens when we emulsify them or use different things? Knowing your ingredients can end up in a beautiful dish that tastes fantastic. Right? But if you don't know how your ingredients work, oftentimes you're eating something, you're like, this is not good, but you don't even understand why. So you really have to know how the ingredients work to get a beautiful dish. That's the same thing with your composites. You have to understand their advantages and disadvantages, how they work in different ways. So here's Color, and Color is an interesting composite because it's new and it has some very specific ingredients that make it different than others. So what I wanted to talk about is low shrink versus shrinkage stress. This is a hot topic right now because there's a lot of bulk fill out there. Low shrink composites is kind of a buzzword. A lot of people want low shrink, low shrink. And so there is a difference between low shrink and shrinkage stress. What we now know is that shrinkage stress is what matters. How much shrinkage there is, polymerization shrinkage, isn't as important as how much stress is related to that shrinkage. And so packable resins have shrinkage, polymerization shrinkage of 0.9% to about 3.5%. Flowables can be anywhere upwards to 6.7%. But again, the polymerization shrinkage isn't exactly what matters. It's the shrinkage stress. So here are two studies. The one on the left is a third party. The one on the right is an in-house study, just showing Color against some of the other competitors about volumetric or polymerization shrinkage. And it is pretty low, about 1.72%. It's lower than most packable composites. You see Filtech low shrink is super low shrink. So there was this study done about low shrink versus shrinkage stress. And what they did is they looked at cuspal deflection, essentially bonding a tooth and then filling it with the packable resin and seeing how much cusp deflection there was for 4 quote-unquote low shrink composites. What they found was interesting in that all of the composites were different in how much they shrank. 2 were significantly lower than the others, but they didn't necessarily have lower shrinkage stress. Here's another study that was done saying the same thing, that not all low shrinkage composites demonstrate reduced polymerization shrinkage. It's really about the elastic modulus. That's much more important in understanding the shrinkage stress. So when you're thinking about a composite that you're doing and how you're packing it and how you're curing it, which one you're using, you want one that has low shrinkage stress, not just low shrink. So here's another study. The one on the left is a third party. The one on the right is in-house. You can see that Color has definitely low shrinkage stress in comparison to some other popular composites on the market today. That's the same thing that they've found across the board. What's interesting is that GC America wanted to create a flowable composite that's similar to a packable composite in a lot of characteristics. And so they came up with this new one called Genial Universal Flow. And so it had similar shrinkage stress that's very low, but also could wear well against opposing dentition. So you could use a flowable in areas where you would be using a packable. So you can see here that the volumetric shrinkage of Genial Universal Flow isn't a lot different than some of the other flowable composites. But their shrinkage stress is definitely low as well, so that's really good. You want to have something that has a very low shrinkage stress, especially in those areas around the box and the occlusal surfaces. So where does shrinkage stress come from? Shrinkage stress in our composite resin can come from a couple of different places. The most prominent is in the resin matrix or in the monomer. And so there are different ways or different monomers that we can come up with to reduce shrinkage stress. Also, the amount of filler, how heavily filled by weight is the composite. That oftentimes can also reduce shrinkage stress. How many glass fillers in their size can also talk about it. All right. Just a couple questions that people have said, just reviewing some things. The percentage shrinkage, what is the percent shrinkage of flowable composite? Again, it can be anywhere from 3% to 6%, but it's the shrinkage stress that's the most important. Some people asked about dual cure composites. Yes, there are very few true dual cure composites to reduce that. I'm hoping that in the future they're going to come out with more dual cure composites to help reduce shrinkage stress. And someone else asked about bulk fill or layering, and we're going to talk about that here in just a moment. Okay, so this study shows that the resin matrix is the biggest really indicator of where shrinkage stress lies. So what GC did with Color is that they created a whole new monomer in the resin matrix. They found something that was a lot heavier. So they went outside of dentistry to DuPont and they said to these chemists, hey, we want you to create this new monomer. Now, I actually met some of the chemists who did it. Oh my goodness, I could barely understand what they were saying because it was so far above my head. But when they broke it down into these terms, essentially it's a very, very heavy molecular weight monomer. As you can see here on the right, bis-GMA, tegumol, all those different things. Here's their molecular weight. and then you can see what the molecular weight is of this new monomer in the resin matrix of Color. So essentially what happens is that when you have a larger, heavier molecular weight monomer, which is much, much longer, right? If you look at the monomer here, look how long this is versus this chain. So when you have a heavier monomer, you actually have fewer areas where they can polymerize, hence you have less overall shrinkage. So Color is 82% filled by weight, a very, very heavy composite, and hence their shrinkage stress is very low. Now when you talk about the wear rate of your composites, what you want to avoid is plucking at the margins. One of the things that you hear about is the white line around composites over time, and what can happen is that shrinkage stress can pull at the margin, and then bits of material, bits of the composite can be polished into that area if the shrinkage stress is too heavy. That's something that John Burgess talked about in the latest issue of the Journal of Cosmetic Dentistry. So what Color has tried to do is change some of those things, and what they did is that they had an enhanced pre-polymerized filler. So they had these fillers that are already cured essentially, creating a heavier weight in there, and that has special lining that can bond better with the resin matrix, hence decreasing the plucking at the margin. So here's just an example of some scanning electron microscope images here that show what plucking looks like in different materials. But Color has definitely decreased that plucking rate. So we have multiple flowables that have been identified as bulk fill with low shrinkage stress. Now the ones that have really changed the market would be SureFill SDR Flow, and that has some pretty high shrinkage but really low shrinkage stress. So they've done things in there that is really decreasing shrinkage stress. So if you're going to use a bulk fill flowable composite, I would definitely recommend SureFill SDR Flow. Venus Bulk Fill has also changed some things, which has allowed them to do it. But I would say if you're going to choose one that's a flowable for bulk fill, then SureFill SDR Flow. But you cannot use SureFill on occlusal surfaces. Anywhere that's going to have wear, it has very, very low wear rate. And that's where Genial Universal Flow comes in, this new one by GC. Their flexural strength is very, very high. You can see higher than any of the flowables on the market, and it's higher than a lot of the universal composites that are on the market also. But the best thing about it is that the wear rate is very, very low. It's much closer to other packable composites. You can see here what I was talking about with SureFill SDR Flow. You can't put that on a surface where there's going to be function. So here's an example of a combo case where I use some flowable and some packable. I have a couple of occlusal restorations. I'm going to use a flowable here, Genial Universal Flow, and then I'm going to use Genial Universal Flow here in the box, and then Color over the top. So I get my matrix in there, and then you can see that I'm filling up a lot of the box here with a very strong flowable. That's the Genial Universal Flow. And then I am bonding, I'm curing that one until it's fully cured. Someone I was asking about sonic fill, and these studies didn't include sonic fill, and I can talk about sonic fill here in just a moment. I'm very familiar with that as well. So here is the completed restoration with Genial Flow on the base and then Color on the top. And then I go back and I do it again for those proximal restorations. You can see here I'm putting Genial Universal Flow in the box and then Color right over the top. Using my discs to get those beautiful contours, and there we have the completed restoration. There it is, start to finish. I like to make these vignettes for my patients to help them see what they can do if they were wanting to replace some of those fillings. One other thing about Color, and then I'll come back and talk about sonic fill and some other bulk fill materials. One of the great things about Color is its chameleon effect. Chameleon effect and having it blend into the tooth is really about different refraction indices. The more refraction indices you can have, the better it's going to look, because that's the way that light hits the tooth. It changes in many different ways. Visible wavelength of light is 400 to essentially 800 nanometers of light, and so you need to have a lot of different glass fillers in there that can change the way that the refraction indices hit the composite, so it more mimics a tooth. So you can see here the way that the light transmits off the enamel, the DEJ, peritubular dentin, all those different things are different, and which gives the tooth its color. And so what you want to have in your composite is a number of different refraction indices. Pre-polymerized fillers help that out, different size glass fillers, the resin matrix, all of that plays a key part in making sure it looks beautiful. And that's one of the difficult things with some of the bulk fill materials, is that they're not able to have a lot of those different refraction indices, because you can put a lot of different filler content in there, hence some of the more opaque or monotone colors with some of those bulk fill materials. So here's an example again from that first one, chameleon effect. Here is again, you can see how beautiful these restorations look. And there it is from beforehand. Here it is again, the final. And there it is beforehand. Someone was asking about another bulk fill material, about tetric avoceram bulk fill, and that you could definitely use that on the occlusal surface. And things are moving much more towards bulk fill, and we'll talk about that again here in just a minute. What I want in my mouth and all my patients' mouth, I want composites that don't look like this. When I see these in my office, I sometimes cringe, and I'm thinking, first off, boy, did I place these composites? Are these mine? I want to make sure that mine look beautiful and are long-lasting. And so using a composite that will wear beautifully and will look beautiful in any portion of the mouth in one layer is what I want, and that's something that Color can give me. Now, as far as some of these other bulk fill restorations, I've used a lot of different bulk fill materials. Voco has one, right? Ivoclar has one. Sonic Fill is a great bulk fill restoration. All of those have great properties, and I think that more and more things are moving to bulk fill. I suggest that you can use those in many situations, and it's just depending on what you want. You've got to know your material. What are its limitations? What are its strengths? When do I use it? When do I not use it? When it's really important to have your chameleon effect. I can use Color anywhere in the mouth and have a beautiful restoration. I can't do that with Sonic Fill or some of the other bulk fill restoration materials. Although I do use Sonic Fill also in my practice. I think it's a great material. I think that there are a number of great materials on the market. It's knowing what works best for you and in what situation. So really my intent is to have you understand where to use certain materials and how to use certain materials and understand where it is. Someone else was curious about TPH. They've just come out with a new one, TPH Spectra, that has combined a lot of the shades, and the newest one is probably my favorite. TPH Spectra again has reduced the number of shades for an improved chameleon effect with fewer number of shades. But again, I have never seen anything better than Color in a universal one shade application. Here's my little brother, and he had chipped 2 teeth in the anterior, and again I can use Color anterior posterior. You can see here it is a little up close. There are 2 class 4 restorations there. They look pretty good. Let's get closer. They look good. Closer. Alright, so now you can see maybe just the beginning of it there. Now there are the 2 class 4 chips that I'm going to repair, and I'll just show you how we did this with Color. One thing that I like to do, no matter what system you're using, if you're going to repair on the anterior, is you take a little piece of the composite and you put it up on the tooth and you cure it so you can get a really good idea of what it looks like on the tooth. With the chameleon effect with color, you can use a universal shade for the majority of the time, and then it has some of the translucent shades in the end. Basically, whatever you want to do, you can do with color. I'm using A2 quite a bit, but you can use B1 or A1, and then the translucent ones are really nice for a finish on the anterior teeth. So here I am, I've beveled it a little bit more, roughened the surface a little bit more, and then I did my bonding steps, and then I'm applying color. This is one shade. I'm using my discs to start to contour it, and there it is. One shade. So again, my point is make sure you understand and know your materials. Know your ingredients, know how they work so you can have a great result. Alright, someone else asked about sonic fill. It says you don't need to use a flowable composite underneath. I would definitely not use a flowable composite underneath sonic fill. You can just bulk fill that up to 4 millimeters. I want to talk a little bit about bonding in the next 20 minutes, and maybe we can even do a little bit more with Q&A at the end. Bonding really comes down to technique. One more little story here for you. I am not a good fly fisherman. And you can see the size of the fish in my hand. Now, I've been trying really hard for a long time to be really good, and this is the first fish I caught in a number of years, and I was super proud of myself. And I asked the guide who was with me, I said, hey, how old is this fish? He's like, oh, maybe a year old. And I said, so does that mean younger fish are more stupid than the other ones? And he's like, oh, yeah, for sure. They're definitely dumb. And I said, well, why can't I get the big ones? He's like, it's your technique. Your technique's not very good. And so I was showing this to my buddy, and he said, well, my son's he's got pretty good technique, and this is what he got. So, yeah, technique matters. Technique matters, and it matters in bonding. Now, what's been coming out here is a lot of universal bonding agents, right? We got bulk fill, we have universal bonding agents. That's the hot stuff right now. Everyone wants to know about universal bonding agents. How can you use them? So your technique is very, very important if you know your ingredients and you know your technique. So with universal bonding agents, you can do it in 3 ways. You can do a total etch, you can do a select etch, or you can do a self etch. But make sure you understand how to do each one. So with a total etch, you need to remember that's where you get the best etch on the enamel surface. Here's a SEM of phosphoric acid etch. Here's a SEM of self etch. So you have to be careful on your enamel surfaces as often as you can. Even with the universal bonding agents, I would say if you have enamel that you really want to bond to, I would do either a total etch or a select etch. Here was an interesting article that was done in 2005. It talked about 3-step etch and rinse, 2-step self-etch. Both of those are clinically reliable. But the 1-step self-etch adhesives they found was inefficient for clinical performance. So be very careful and very judicious on when you're using a 1-step self-etch system. Now, Dentsply came out with this kind of guide, and I thought it was actually very good. And so it shows where to use total etch and where to use self-etch. So here, total etch in these types of situations, class 5s, you can use in total etch everywhere. In a class 2 restoration where there's a lot of dentin, you can use just a select etch and just using the phosphoric acid etch on the enamel here, and then using your self-etch inside the box. And when you have no enamel present, well, that's a good time to use the self-etch. Now remember, self-etch bonding agents did do rather well on dentin alone, but when it's the enamel, that's where the problem lies. So if you just have dentin, then self-etch is okay. So if you're bonding the crown in and it's mostly just dentin, then using a self-etch technique is sufficient. So again, total etch in these situations, if you're doing veneers, or if you're doing class 5 or something that's shallow, doing a total etch is what I would recommend. Now, if you're doing a crown, if you're bonding in crowns like I often do, I like to bond in my crowns, then a self-etch is usually sufficient because you have a lot of dentin and your self-etch bonding agents often do well on dentin, just not on enamel. So in your class 2, you can use a select etch. Now the hard thing was, for so long I could never get my total etch material to sit right on the enamel edge without getting down into the box. And what used to happen before the universal bonding agents came out with the 6th generation, your 2-bottle self-etch, if you had any select etch, if you had any of that phosphoric acid etch get down onto the dentin, then it would compromise the bond of your self-etch systems. So what's happened with the universal bonding agents is that has been changed quite a bit. You can either do the total etch or the select etch, and it doesn't decrease the bond on the dentin. So that's a big advantage. So here's a product that if you're using select etch, I would definitely recommend. It's select etch high viscosity, select high viscosity etch by Bisco with benzalkonium chloride in it. So here you can put it on. It's sometimes a little bit harder to extrude, but it doesn't move. And so you're able to just etch the enamel. And that's something I really like if you're using select etch. So if you're doing a select etch portion, that's what I would use. So if, for example, you want to use Genial Bond. So Genial Bond is one of those universals, right? You have Scotch Bond universal, you have All Bond universal, you have Genial Bond, you have Prime and Bond Elect. These are all the universal ones that are on the market right now. And if you're going to use Genial Bond and you want to select etch, then I would use this high viscosity etch, because that really is where it's at. So when you're bonding, basically the thing is that it's very technique sensitive. So you want to make everything as simple as possible, but not simpler. And that was something that Einstein said. Okay. I have about 15 minutes, and I could go more about bonding, but I might take more questions right now. We can just do some questions, and then if we want to do more about bonding, we can go there. Okay? So go ahead and load in your questions. Oh, let me take 2 polls here first, actually. Let's do a couple polls, and then maybe some questions will spark from that. Okay. So, because we're talking about bonding, here it is. What type of bonding agent do you use 80% of the time? A 4th generation 3-step etch and rinse like Optibond FL, Scotch Bond multipurpose, the 1st generation. How about 5th generation, your 2-step etch and rinse? That's like Optibond Solo Plus. How about a 6th generation like Clearfill SE or Optibond XTR? That's a recent, very popular one. How about a 7th generation like Optibond All-in-One? There are so many. G-Bond, I-Bond. How about a universal bonding agent? How many people are using universal bonding agents? A total or select etch type, or a universal bonding agent, your self-etch? Let's see what people say here. Looks like we still have a lot of people using that 5th generation type. All right, we're going to give about 10 more seconds here with this poll. Okay, so everyone can see here what most people said. So it looks like the biggest group is the 5th generation 2-step etch and rinse. That's what I was using too. I was using Optibond Solo Plus for a really long time. But one of the reasons why I changed was the film thickness was pretty thick, and I wanted something a little bit thinner and to try to decrease post-operative sensitivity. I wasn't having a lot, but I wanted to make sure that it was as minimal as possible. I didn't want to go to the 7th generation because I felt like I couldn't get a predictable bond to my enamel. So I moved to Optibond XTR. That's what I'm using primarily, the 6th generation, because it has a very intense etch on the enamel for a self-etch bonding agent, and it has a very thin film thickness, about 5 microns. But you can see a lot of people are using universal bonding agent. They've switched over because it's an easy switch. It's very similar, but you can do more things with it. So that's great. Very interesting there. You can see what people around the world are doing. Again, whatever you're doing, make sure you just understand what you're doing, how to use it the best. And that's the most important thing, that you understand what you're bonding agents your composites are doing. All right, one more poll here. This one is about, are you using a bulk fill composite material? Are you using a flowable? Are you using a packable? Are you using a flowable and a packable? Or you're not using any type of bulk fill material? I thought this would be interesting. All right, we're going to give about 10 more seconds here. Okay, this is interesting also. You can see of almost 75% of us are using some type of bulk fill material, whether it be the flowable or a packable or both. It looks like some people are using it in different situations. And that's very interesting that people have latched onto that bulk fill. I think it's what we've been wanting, all of us, for so long. We've really wanted a bulk fill. And for many situations, it's very handy to do. That's one of the great things about genial universal flow is that, for example, in a very small class 2 box, you can use a flowable that is also strong enough to wear against opposing surfaces. And so that's one of the advantages of using genial universal flow. But also sonic fill in areas like that where you can flow it in and then cure it. The most important thing with bulk fill is polymerization. You have to make sure you cure it for the long enough time. You want to make sure that you're curing it from the buccal, from the lingual, from the occlusal, especially with sonic fill. If you're bulk filling it, you want to make sure that you take long enough to cure it all around, and then you can have great results there. All right, let's get some more questions here and see what I can do. Oh, people were asking if I'm using a polish paste after a lot of things. What polishing systems have I been using? I use a lot of discs, and then I will use just usually one cup. I use a Pogo or the Enhanced by Dentsply. I like those throwaway ones because I can get it in there and I usually get a good finish. I haven't been using a lot of paste, but I usually just use 1 or 2 cups. Someone said, why have I been getting post-op sensitivity since trying SureFill SDR Flow? That I think is more technique sensitive. I would say that usually post-operative sensitivity is more towards the bonding than it is SureFill SDR Flow. I use SureFill SDR Flow for about a year and a half and really not having much post-operative sensitivity. So think about how much you're layering it. I would probably just do about 3 millimeters or 4 millimeters at the max. Making sure you have full polymerization on that, and also be very careful with your bonding procedure. That's about all I could say for that. Someone was asking about building the incisal edge of a chipped tooth. I'm assuming in the anterior, using a flowable composite. You have to be careful about its strength and its ability to withstand the function where it's being placed. So that's what I would say. It depends on the function of where it's at. But I usually like to use packable composites and layer those in the anterior. Except with Color, I can often use just one layer. Yeah, someone was saying about the aesthetics of sonic fill, and that's what I'm talking about in your difference between Color and sonic fill. The aesthetics aren't incredible with sonic fill. It doesn't have that chameleon effect that Color does and a lot of the packable composites do. So if you're using, yes, it is extremely dense and void free, it's beautiful on radiographs. So you can cover it with another composite. Sure, that's a great way to get aesthetics in certain areas if you want to bulk fill. Someone was asking about if I ever pre-wedge. I think that's a great idea. Also with those fender wedges or wave wedge. Just so you guys know, I'm going to put my email address up here real quick. So that way you can email me with any questions after we're done. But someone was saying, oh yeah, do I ever pre-wedge? I do very often, especially when I am prepping against a tooth that doesn't have another restoration, and I'm not going to be cutting on that tooth. I like to pre-wedge there, separate the teeth a little bit, and also use that wedge guard. I love that wedge guard. It just makes me feel more confident in what I'm doing. How long to finish a class 2 composite filling? 1 hour or 45 minutes. For me, that's interesting. I am about, depends on what you're doing and how quickly you work, but I usually do about, an MO and a DO in about 45 minutes to an hour. It depends, on certain smaller ones with sonic fill, or it depends what you're trying to do. You can even reduce that even more. But again, it's knowing your materials. You got to know your materials, figure out how it works best. Oh, okay, someone else was talking about sonic fill over sure fill with postoperative sensitivity. I'm not having a lot of postoperative sensitivity when I'm using sonic fill. And again, maybe you're bulk filling too large. I wouldn't go over 4 millimeters. Someone was asking about over-curing won't harm or reduce the mechanical properties of composites. Absolutely not. Over-curing it will not decrease any of the properties of composites. You want to cure it very well. Some people have talked about ramp curing or pulse cure. Does that change the polymerization shrinkage? And what they found in the studies that it doesn't. It doesn't affect it very much. So, getting a good curing light is very, very important. In fact, something with collimated light is very, very good. Using a Velo light is a great light. The Smart Light by Dentsply is a great light. I would say the Velo light is probably the best one on the market right now, and it's very, very powerful, and I would say that. Do I ever use Gluma? I do. Gluma is something that works with protein precipitation, and so it actually precipitates proteins in the dentinal tubules as you scrub it on in there. And so you can use Gluma. You just have to be careful because it is caustic to the tissues. And so if you're using something like a class 5, you can burn the tissues and have problems there. So that was just the only thing to be careful about that. What do I think about G-Bond? G-Bond is a 7th generation bonding agent, and I don't use any 7th generation bonding agents in my practice. I like to use either a universal, like Genio Bond would be a much better choice in my opinion. Any 7th generation, unless you're just using it for bonding crowns, I think that's good. But I personally don't use any 7th generation in any of my class 2 restorations. Oh, okay. Someone was asking about I couldn't do multiple restorations with the Triodent system without having to remove one. No, I just do that because I wanted beautiful restorations as far as the contours. You can definitely do back-to-back. I was just doing it that way to make my restorations look even better. Oh, someone said, are Pogo and Enhance are sterilizable? No, they're single use.